Over 60? 4 fruits you must eat and 4 you should never touch. My friend, if you're over 60, this message is especially for you. There are fruits in your kitchen right now that may be healing you or silently harming you. Some fruits can strengthen your heart, sharpen your memory, and ease digestion. But others, they can quietly raise your blood sugar, slow your metabolism, or even hurt your joints. You deserve to feel strong, light, and energized in your golden years. So before your next grocery trip, please watch this. These 4 fruits could change how you age, and the 4 you must stay away from might shock you. If this message speaks to you or someone you care about, please tap the like button and subscribe. We're building a community where aging means thriving, not slowing down. Text blah. Drop a comment if you felt confused about healthy foods before. You're not alone, and we're here to help. 4 fruits you must eat for strength, heart, memory, and digestion. Number 1. Blueberries are among the most beneficial fruits for people over 60, especially when it comes to protecting brain function and supporting heart health. These small, vibrant berries are packed with antioxidants, particularly a group called anthocyanins, which give them their deep blue color. Studies have shown that these antioxidants can help reduce oxidative stress in the body, a process that becomes more aggressive with age and contributes to memory loss and cognitive decline. For seniors, even a modest daily intake of blueberries has been linked to noticeable improvements in memory and overall mental clarity. In research published by the National Institutes of Health, older adults who consumed blueberries regularly showed better performance in memory tests compared to those who did not. Blueberries are also known for their anti-inflammatory properties. Chronic, low-level inflammation becomes more common as people age and is a key factor in many age-related conditions such as arthritis, heart disease, and even certain types of dementia. Antioxidants in blueberries help calm this inflammation, supporting not just brain health, but overall well-being. Some doctors recommend blueberries as a simple, natural way to reduce inflammation without the side effects of medications. Because inflammation doesn't always cause obvious symptoms, this type of support can quietly work in the background, helping the body maintain its balance. Cardiologists often encourage people over 60 to choose heart-friendly foods, and blueberries are at the top of that list. They are low in calories, low in sodium, and contain compounds that help lower blood pressure and improve the elasticity of blood vessels. This is especially important for older adults, since blood vessels naturally stiffen with age. A study published in the American Journal of Clinical Nutrition found that participants who ate a cup of blueberries daily experienced a significant improvement in arterial function and a reduction in systolic blood pressure. These changes can reduce the risk of heart attack and stroke, making blueberries more than just a tasty snack. They're part of a heart protective routine. Another overlooked benefit is how blueberries affect mood and emotional balance. Some studies suggest that the polyphenols in blueberries interact with gut bacteria in a way that may influence the production of neurotransmitters like serotonin. For seniors experiencing mild mood changes, anxiety, or emotional fatigue, this natural support may make a meaningful difference. While blueberries are not a substitute for medical treatment, their gentle, consistent effects on both the brain and body make them a smart and safe choice. A daily handful, whether fresh or frozen, can offer real and lasting benefits for those over 60 who want to protect their memory, support their heart, and feel more stable and sharp each day. Number 2. Papaya is one of the most digestion-friendly fruits recommended for people over 60. It contains a powerful natural enzyme called papain, which helps break down proteins in the stomach, making digestion easier and more efficient. As the body ages, it produces fewer digestive enzymes, leading to common problems like bloating, constipation, and indigestion. Papaya gently supports the digestive system, helping food pass through more comfortably and reducing the heaviness or discomfort that can come after meals. Some nutrition experts suggest that even a small serving of ripe papaya a few times a week can make a noticeable difference in regularity and gut comfort. In addition to its digestive benefits, papaya is rich in vitamins A, C, and E, nutrients that support immune health and help protect against age-related cellular damage. Vitamin C, in particular, plays a key role in collagen production, which affects the strength and flexibility of skin, joints, and blood vessels. A study in the Journal of Nutrition and Aging reported that older adults who consumed fruits high in vitamin C, like papaya, showed better skin elasticity and fewer joint complaints compared to those with lower intake. The antioxidant content in papaya also helps neutralize free radicals, which contribute to the aging process and can affect everything from vision to heart health. For people managing inflammation, papaya offers gentle support without adding strain to the digestive tract. Unlike more acidic fruits, papaya is low in acid, making it suitable for those with sensitive stomachs or conditions like acid reflux. Some dietitians recommend papaya for older adults experiencing arthritis flare-ups or chronic pain, noting that its enzymes and antioxidants may help reduce internal inflammation over time. Its anti-inflammatory effect is subtle but steady, offering support without harsh side effects. Papaya also contains folate and potassium, which help regulate blood pressure and support heart function. Potassium is particularly important for seniors, as it helps balance sodium levels and maintain proper muscle function, including the muscles of the heart. The fiber in papaya is another valuable benefit. It not only supports digestion, but also helps control cholesterol levels. According to research published in the American Heart Journal, diets high in fruit fiber were associated with a lower risk of heart disease in adults over 60, and papaya was among the fruits highlighted for its soluble fiber content. Because of its soft texture, papaya is easy to chew and gentle on aging teeth. For seniors with dental issues, it provides a comfortable way to enjoy a nutrient-dense fruit without strain. Taken all together, papaya's enzyme support, anti-inflammatory properties, immune-boosting vitamins, and heart-friendly nutrients make it a smart, nourishing choice for people in their 60s and beyond. Number 3. Apples are one of the most accessible and beneficial fruits for people over 60, offering a combination of fiber, hydration, and heart-friendly nutrients that support healthy aging. One of their most important benefits is their high content of soluble fiber, especially pectin, which helps reduce cholesterol levels. Elevated cholesterol is a common concern in older adults, and research published in the American Journal of Clinical Nutrition has shown that eating apples regularly can lead to a modest but meaningful drop in LDL, the so-called bad cholesterol. Lowering cholesterol levels helps reduce the risk of heart attack and stroke, two major health concerns for seniors. In addition to their heart benefits, apples help regulate blood sugar levels, which is essential for people managing prediabetes or type 2 diabetes. Although apples contain natural sugars, the fiber slows down the absorption of glucose into the bloodstream, preventing spikes that can lead to fatigue, dizziness, or long-term insulin resistance. Some endocrinologists recommend apples as a safe fruit for blood sugar control, especially when paired with protein or healthy fats. Their low glycemic index makes them a better choice than many sweeter fruits, especially for seniors who are watching their carbohydrate intake. Apples also support digestive health, a concern that becomes more common with age. As the metabolism slows and gut bacteria change, constipation and irregularity can develop. The fiber in apples, especially when eaten with the peel, adds bulk to stool and encourages regular bowel movements. Gastroenterologists often suggest increasing fruit fiber rather than relying on laxatives, which can lead to dependency or dehydration. Apples provide this support in a gentle, natural way that promotes long-term gut health. Their high water content also contributes to hydration, an issue that is often overlooked in older adults. Many seniors experience a decreased sense of thirst, which can lead to dehydration without obvious symptoms. Apples, being over 80% water, help contribute to daily fluid intake and can be especially helpful for those who forget to drink enough water throughout the day. Proper hydration supports everything from kidney function to mental clarity, making water-rich fruits like apples valuable in a senior's diet. Apples contain a variety of plant compounds, including quercetin and flavonoids, which have been linked to reduced inflammation and better immune response. While not a cure-all, these compounds may support the body's natural defenses against illnesses and infections. Because apples are easy to find, affordable, and come in many varieties, they can be enjoyed daily without boredom or excessive cost. Their crisp texture encourages chewing, which stimulates saliva and supports oral health, especially important for older adults. For seniors looking to maintain steady energy, protect their heart, and support digestion, apples offer a reliable and nourishing choice that fits easily into most diets. Number 4. Pomegranate is a deeply nourishing fruit for people over 60, particularly when it comes to heart health, blood flow, and hormone balance. Its juice and seeds contain compounds called polyphenols, especially punicalagins and anthocyanins, that help relax blood vessels, improve circulation, and reduce blood pressure. A study published in Clinical Nutrition showed that older adults who drank pomegranate juice daily for several weeks experienced measurable improvements in both systolic and diastolic blood pressure. These effects are especially helpful for seniors, whose arteries naturally stiffen with age, increasing the risk of hypertension, stroke, and heart failure. By supporting blood vessel function, pomegranate acts as a natural ally to aging cardiovascular systems. In addition to heart benefits, pomegranate has shown promise in supporting prostate health, making it particularly valuable for older men. Some clinical trials suggest that pomegranate extract may slow the rise of PSA, prostate-specific antigen levels, in men with prostate issues. While it's not a treatment or replacement for medical care, some urologists believe pomegranate may help reduce oxidative stress and inflammation in prostate tissues, offering a layer of nutritional support. As prostate problems become more common with age, especially after 60, this kind of dietary addition can offer gentle, long-term benefit without added medication burden. The fruit's strong antioxidant profile also protects the body against oxidative stress, a key factor in aging-related diseases. Pomegranate's antioxidants are known to be more potent than those in red wine or green tea. These compounds help prevent the buildup of plaque in arteries, support brain health, and may even reduce stiffness in joints caused by inflammation. For seniors experiencing fatigue, poor circulation, or memory changes, improving blood flow through natural foods like pomegranate can offer both physical and mental support. Some cardiologists note that improved circulation can also lead to better energy, sharper thinking, and more comfortable mobility. Pomegranate is rich in potassium, a mineral that supports heart rhythm and helps counteract the effects of sodium, which is especially useful for older adults managing high blood pressure. It's also a source of vitamin C and vitamin K, which play roles in immune defense and blood clotting, both of which become more fragile with age. Including pomegranate in the diet, whether through the seeds, juice, or in smoothies, can help seniors get these nutrients in a flavorful and low-fat form. For many older adults, chewing can be difficult due to dental concerns, but pomegranate seeds are soft enough for most people to enjoy, especially when mixed with yogurt or added to soft foods. For those who prefer juice, unsweetened pomegranate juice provides similar benefits without needing to chew. Whether eaten or sipped, this fruit offers a well-rounded set of nutrients that gently support the heart, hormones, and circulation, helping people over 60 stay active, balanced, and protected. 4 fruits you should never touch for sugar spikes, digestion trouble, and hidden dangers. Number 1. Grapes are often seen as a light and healthy snack, but for people over 60, they can pose hidden risks, especially for those managing blood sugar levels. Despite their small size, grapes are packed with natural sugars that are rapidly absorbed into the bloodstream. This fast absorption can cause sudden spikes in blood glucose, followed by sharp drops, which may leave older adults feeling lightheaded, tired, or shaky. These rapid fluctuations can be especially dangerous for seniors with prediabetes or type 2 diabetes, where blood sugar control is already compromised. Some dietitians caution that even small portions of grapes can disrupt glycemic stability in sensitive individuals. Unlike fruits that are high in fiber and help slow down sugar absorption, grapes contain very little fiber relative to their sugar content. That means the body processes them almost like candy, fast and all at once. Endocrinologists often advise patients with insulin resistance to be cautious with high glycemic fruits like grapes. Eating a handful might seem harmless, but for someone in their 60s dealing with reduced metabolic flexibility, it can silently undermine efforts to manage weight, mood, and energy levels. Beyond blood sugar, grapes can contribute to inflammation when consumed regularly in large amounts. Chronic inflammation is a major factor in aging-related diseases such as arthritis, cardiovascular issues, and even memory decline. While grapes do contain some antioxidants, their sugar load often outweighs those benefits for people with underlying inflammatory conditions. Some nutrition experts suggest replacing grapes with lower sugar fruits that offer similar antioxidant benefits without the glucose burden. Another concern is portion control. Grapes are small, easy to snack on, and often eaten mindlessly. It's not uncommon to consume dozens of grapes in a single sitting, especially when watching TV or preparing meals. This habit can quickly lead to unintentional overconsumption of sugar and calories, which may contribute to weight gain or worsen existing health issues. Overweight and obesity in older adults are closely tied to joint pain, sleep problems, and cardiovascular strain, all of which can reduce quality of life in later years. Grapes also contain fructose, a type of sugar that is processed in the liver. In excess, fructose can contribute to fatty liver disease and other metabolic complications. For older adults already managing liver function, cholesterol, or triglyceride levels, this is another reason to be cautious. Some nutritionists recommend that grapes be limited to rare treats rather than regular snacks, especially for individuals who are inactive or taking medications that affect blood sugar or liver enzymes. While grapes may not be harmful to everyone, they are not the best choice for seniors who need to prioritize blood sugar stability, energy balance, and inflammation control. Choosing fruits with higher fiber and lower sugar can offer better support for long-term health. Number 02. Bananas are commonly viewed as a convenient and nutritious snack, but for people over 60, they may create more problems than benefits. Despite their popularity, bananas contain a high amount of natural sugar and low fiber, particularly when fully ripe. This combination causes sugar to enter the bloodstream quickly, leading to a sharp rise in blood glucose. For older adults with insulin sensitivity or pre-diabetes, this sudden spike is often followed by a rapid drop, which can leave them feeling fatigued, lightheaded, or anxious. Some endocrinologists caution that eating a banana by itself, especially on an empty stomach, may destabilize energy levels and interfere with glucose control in seniors. In addition to blood sugar concerns, bananas are known to be high in fermentable carbohydrates, specifically a type called FODMAPs. These compounds are poorly absorbed in the small intestine and tend to ferment in the gut, which can cause bloating, gas, and discomfort. This effect is more pronounced in aging digestive systems, where enzyme production and gut motility tend to slow down. Many gastroenterologists note that older adults who struggle with irregularity, indigestion, or a sensitive gut may notice increased bloating or sluggish digestion after eating bananas, especially when consumed frequently or in large amounts. Bananas are also rich in starches that convert to sugar quickly as the fruit ripens. While green or slightly unripe bananas contain more resistant starch, which acts like fiber and slows digestion, most people eat bananas when they are fully yellow or spotted, at which point the starch has largely turned into simple sugar. At this ripened stage, the fruit loses much of its blood sugar balancing potential and can behave similarly to processed carbohydrates in the body. For seniors trying to maintain steady energy, reduce cravings, or manage their weight, this can be counterproductive. Another concern is the high potassium content of bananas. While potassium is an essential mineral, excessive intake, especially from concentrated sources, can be risky for older adults with kidney problems or those taking certain medications like ACE inhibitors or potassium-sparing diuretics. In these cases, potassium may build up in the bloodstream and lead to muscle weakness, fatigue, or heart rhythm disturbances. Some nephrologists warn that seniors with reduced kidney function should monitor their potassium levels closely and limit high potassium foods, including bananas, to avoid complications. Although bananas offer some nutrients such as vitamin B6 and vitamin C, their potential to spike blood sugar, slow digestion, and cause bloating makes them a less ideal choice for many people over 60. For those dealing with metabolic issues, sensitive digestion, or medication restrictions, it may be wise to limit banana intake or substitute with lower sugar fruits that are easier on the body and gentler on the gut. Number 03. Pineapple, while rich in flavor and nutrients, can be problematic for people over 60 due to its high acidity and sugar content. As the body ages, the digestive system often becomes more sensitive. The acid in pineapple, particularly citric and malic acid, can trigger or worsen symptoms of acid reflux, a condition that becomes more common in older adults. For seniors who already struggle with heartburn, indigestion, or gastroesophageal reflux disease, GERD, eating pineapple may intensify the burning sensation or discomfort after meals. Gastroenterologists often advise those with reflux to avoid acidic fruits like pineapple to help reduce inflammation in the esophagus and promote more comfortable digestion. Beyond digestion, pineapple's acidity can also have a negative effect on dental health. Many seniors face challenges with enamel erosion, gum sensitivity, or exposed roots due to years of wear or dental work. When acidic foods like pineapple come into contact with already vulnerable teeth, they can further weaken enamel and lead to increased sensitivity or pain. Some dentists note that even small servings of pineapple, if consumed regularly, can accelerate enamel thinning and heighten the risk of cavities, especially if oral hygiene is already compromised by dry mouth or medication side effects common in older age. Pineapple also contains a high level of natural sugars, which can cause spikes in blood glucose levels when consumed in large amounts or without balancing foods. While it has some fiber, the sugar content often outweighs the benefits, particularly in canned or juiced forms. Seniors managing prediabetes, type 2 diabetes, or metabolic syndrome are often advised to monitor their intake of high-sugar fruits. According to nutritionists, pineapple has a relatively high glycemic index, meaning it causes a quicker rise in blood sugar compared to other fruits. This can lead to energy crashes, cravings, or poor blood sugar control in individuals with impaired insulin sensitivity. In some cases, pineapple may also cause digestive upset due to an enzyme called bromelain. While bromelain has anti-inflammatory properties, it can also irritate the lining of the stomach and mouth in sensitive individuals. Older adults with ulcers, gastritis, or a history of gastrointestinal issues may find that pineapple causes burning, cramping, or nausea, especially when eaten in large amounts or on an empty stomach. Dietitians often recommend limiting bromelain-rich foods in seniors with fragile digestive systems. Although pineapple has some beneficial nutrients like vitamin C and manganese, its high acidity, sugar content, and digestive irritants make it a poor fit for many people over 60. For those dealing with acid reflux, dental concerns, blood sugar issues, or a sensitive stomach, avoiding pineapple may help prevent discomfort and support overall health in a more balanced and gentle way. Number 04. Dried fruits such as raisins, dates, apricots, and figs are often marketed as healthy, natural snacks, but for people over 60, they can be far more harmful than they appear. When fruits are dried, the water content is removed, which concentrates their natural sugars into a small, dense package. As a result, just a handful of dried fruit can contain the sugar equivalent of several whole fruits without the fiber and hydration that help slow absorption. This makes dried fruits highly glycemic, meaning they cause blood sugar levels to rise quickly. For older adults managing blood sugar sensitivity, prediabetes, or type 2 diabetes, this sudden glucose spike can lead to energy crashes, mood swings, and over time, insulin resistance. Nutritionists often caution that dried fruits behave more like candy than fresh fruit. Without water to provide bulk and fiber, the sugars enter the bloodstream almost immediately, overwhelming the body's ability to process them smoothly. This rapid absorption can leave older adults feeling tired or foggy shortly after eating. Additionally, because dried fruits are small and easy to snack on mindlessly, it's very easy to overconsume. Just a few servings can provide more sugar and calories than an entire meal, leading to unwanted weight gain, something that can worsen joint pain, blood pressure, and cardiovascular health in seniors. Another concern with dried fruits is their effect on digestion. The concentration of sugar, combined with a sticky texture, makes them more likely to ferment in the gut, especially in people with slower digestion. This fermentation process can cause gas, bloating, and discomfort. Many dried fruits are also high in sorbitol and other natural sugar alcohols that can draw water into the intestines and lead to cramping or diarrhea. Gastroenterologists often advise patients with irritable bowel symptoms or chronic constipation to avoid dried fruits for these reasons. What's meant to support digestion may end up disrupting it instead. Dental health is another issue to consider. Dried fruits are not only high in sugar, but they're also sticky and tend to cling to the teeth and gums. This can create a breeding ground for bacteria and lead to cavities or gum disease, especially concerning for seniors who may already have dental vulnerabilities. Dentists warn that the combination of sugar and stickiness in dried fruits makes them one of the worst foods for maintaining oral health as we age. While dried fruits may contain trace nutrients, their risks often outweigh their benefits for older adults. The high sugar content, lack of hydration, potential for digestive upset, and impact on dental health make them a poor choice for people over 60. Opting for fresh, water-rich fruits with natural fiber is a safer and more balanced way to enjoy sweetness while supporting long-term wellness. Before you reach for your next piece of fruit, take a moment to think about what your body truly needs at this stage of life. The right choices can protect your heart, sharpen your memory, and keep your digestion running smoothly. But the wrong ones, no matter how innocent they seem, can quietly wear you down over time. You deserve better than that. You deserve foods that work for you, not against you. Now you know which fruits can lift you up and which to leave behind. If this video helped you feel more confident about your health choices, please give it a like and subscribe for more trusted tips made just for you. And if there's a fruit or food you've been unsure about, let us know in the comments. We're here to help every step of the way.